Hey there, this is Dr. Linda Burke. By training, I'm a board-certified OB/GYN physician, but I am equally passionate about teaching people things that they don't know about our healthcare system, but should know in order to keep safe and to prevent them from having bad outcomes. So recently, there have been cases of women unfortunately dying as a result of buying online, quote, abortion pills and then suffering unexpected catastrophes. I'm not here to judge you. I want to be very clear about that. What you do with your body is your business, but I think it's important before you make decisions to be informed about how those decisions should be made. So, mifepristone and misoprostol, those little tongue twister there, those medicines that cause the expulsion of products of conception commonly known as abortion, those medicines were designed to be used early in the pregnancy. How early? No later than 10 weeks. And the reason for the 10-week cutoff is because these medicines are in a category called prostaglandins. And prostaglandins, one of the things that they do is they cause contractions of muscles. So you don't want to have an advanced pregnancy and use these pills. And unfortunately, some of you are doing that, and some of you have died. Particularly if you have incisions on your uterus, such as cesarean, if you had previous cesarean sections with scars, if you had surgery for fibroids, what we call a myomectomy. Don't use these pills, especially if you don't know how pregnant you are, because they can cause catastrophic bleeding. And there have been situations of late, unfortunately, where this has occurred. Before you do anything, you should always, if you have access to an OB/GYN healthcare professional, you should talk to them. But please, if you are beyond 10 weeks, don't use these pills, okay? Because not only, even if you don't have an incision on your uterus, the more advanced your pregnancy, the greater the risk of these pills causing contractions that only expel part of the products of conception, not all of them. And so if you have retained products of conception, that's called an incomplete abortion. And the standard is, under normal circumstances, the standard is a D&C. Unfortunately, we are not under normal circumstances. And so if there are retained products of conception, no one, very few people are going to want to take care of you surgically because they don't want the risk of going to prison. I mean, that's just the bottom line. So the earlier you are aware of your pregnancy, and if this is the route you want to go in terms of having a medical termination, please do it at the prescribed time. The other thing that you need to think about is the location of the pregnancy. You want to make sure that the products of conception is in the the uterus and not in the fallopian tube. Because if you are taking this medication and you have an ectopic pregnancy, meaning a pregnancy that's in the tubes, as the embryo grows, the greater the risk of your fallopian tube rupturing, and you're not aware of it until a catastrophe happens because you did not get verification of the location of your pregnancy. So, if at all possible, get an ultrasound to document that the baby is where it should be before you have the medical termination. Last but not least, and equally important, when you purchase these pills online, you're in uncharted water. You don't know if the ingredients are correct. You don't know if the proper dosage is correct. And why is this important? In 1982, a 7-year-old had a sore throat, and her mom purchased Tylenol that was manufactured by Johnson & Johnson. The 7-year-old died, and 6 or 7 other people died because someone horrifically had tampered with the medicine. And this is why we now have tamper-proof medicine. Prior to 1982, there was no mechanisms, with the tops or a cover over the medicine to cover it. Now there is, and that is the reason why, because of the 1982 Tylenol scandal that led to death. So when you purchase these pills online, buyer beware, because you don't know if the ingredients are legit. So thank you for listening. If you care, please share. I greatly appreciate seeing you, talking to you, and look forward to seeing you next time. Thank you for listening.
Don't play with it, don't be dishonest.